Hello, I'm Kendra Kopanis, Executive Director of Generate Health, and I want to talk with you about one of the community's most pressing issues and how we can work together to solve it. The number of infant deaths in our region is reaching a crisis. I'm going to share what we've learned about this issue and discuss a path forward to help our region improve the health of babies and families. There's a disconnect in St. Louis. We're home to some of the best medical care in the country. We're one of the nation's most well-known centers for medical research, education, and practice, with several top-ranking hospitals. Our children's hospitals continue to be ranked among the best in pediatric healthcare by U.S. News and World Report. Yet St. Louis's babies are dying at an alarming rate. In fact, infant death rates in parts of St. Louis City and County are worse than some developing countries like Vietnam and Uzbekistan. There are also huge gaps in the health of babies in our region. Black babies in St. Louis are 3 times more likely to die than white babies. This gap is so deep that if we keep doing what we have always done, it could take almost 50 years for the survival rates of Black babies to catch up with those of white babies. This is not acceptable, and we must do something different. Many think this is just a problem in St. Louis City, but take a look at the infant death rates by zip code and you can see it affects areas throughout our region. Even the light blue areas on this map have infant mortality rates that exceed the national average of 6 babies dying for every 1,000 born. Many of the dark blue areas have rates more than 3 times the national average. Infant mortality in these communities are 18 babies per 1,000 dying, up to 22 babies dying for every 1,000 born. This is the infant mortality rate of the entire country 50 years ago. The number of infant deaths in our region is astounding. Picture the kindergarten classroom you were in or that your kids went to. Now imagine losing 15 of those kindergarten classrooms every year. That's the number of babies we lose to infant mortality in St. Louis each year. Think of all that potential that is lost. And each neighbor, family member, or friend who loses a baby faces enormous emotional suffering. Imagine how that loss impacts them for the rest of their lives. Our infant mortality rate is affecting our entire region. So the big question is, why is this happening? If we have such great medical care in St. Louis, why do we have so many premature births, and why is our infant death rate so high? And why do we have one of the widest gaps between white and Black baby survival? This chart shows the causes of infant deaths in our region. Birth defects, accidents, and unsafe sleeping practices do play a role in our high infant death rate. But being born too soon or too small is the most significant factor in infant deaths for our region. Premature birth causes more infant deaths than all other causes combined. And many of our region's greatest challenges can be linked to our preterm birth problem, including poverty and economic prosperity. We've long known that the medical costs of caring for a preterm infant are extremely high. Each baby born too early in Missouri results in an average of $75,000 in immediate and short-term costs for state of Missouri, taxpayers, and parents. With the number of premature babies we have in St. Louis alone, that adds up to $180 million each year. Imagine what our region could do with that money. Being born too early can cause health and development challenges for babies all throughout their lives. Premature babies grow up and may need additional services in school and are less likely to advance in their careers as adults. So you can see that the health of our babies has a widespread impact on our community. That's why reducing premature birth and infant mortality should be a shared goal for our community, because we all want a region filled with thriving, healthy adults who are employed and contributing to our community. And that all starts by having healthy moms who can deliver healthy babies. And there are many factors that impact the health and well-being of pregnant women and babies. For example, imagine you've tried to get ahead by earning a certificate from an online college, but they roped you into a loan with extremely high finance rates, and they didn't deliver on their promise of placing you in a job in your field. The bills are piling up. Now you're pregnant. To pay off the loan, you have to take a job that doesn't offer paid time off or health insurance. You need both your and your husband's income to pay rent and put food on the table, so you can't afford to miss a day of work. You start to have serious headaches and a lot of swelling, but you push on and hope it just goes away. And there isn't a place to receive health care that offers evening hours anywhere near you. Your health continues to deteriorate. You're rushed to the hospital. The doctor says it's preeclampsia, which threatens your life and the life of your baby. Now imagine you're pregnant and have a sick toddler. You're trying to get to your appointment, but you can't afford a car, and the nearest doctor that accepts Medicaid is miles away. There's been shootings in your neighborhood lately, so you're worried about sitting at the bus stop for too long. You trudge with your uncooperative sick toddler to the bus stop, which is blocks away. The bus only comes by every 30 minutes, and it's late or you've just missed it. You get to your appointment to find out they can't fit you in. It will be weeks before another appointment slot opens up because not many doctors take Medicaid. These aren't just stories. Real families face these types of challenges every day in St. Louis. All St. Louisans should have the opportunity to make the choices that allow them to have a healthy pregnancy and healthy baby, but many don't have that choice. They face barriers, challenges that block them from having access to the things they need to flourish, such as lack of access to education, living wage jobs, healthcare and healthy foods, as well as horrible neighborhood and housing conditions and the stress families face when dealing with these challenges can all impact the health of a mom and her baby. Our region's families and babies deserve much better. Now, as you can see, reducing infant deaths is a complex issue. It is far more than just about medical care and excellent hospitals. For decades, individual organizations in St. Louis have been making heroic efforts to save babies and improve the health and well-being of women and moms. But a problem impacted by all these different factors can't be solved by one single organization. We must bring these different health, social, and economic pieces of the puzzle together in order to accelerate change and create a lasting reduction in infant deaths in our region. That's why Flourish was formed. We're a new approach to addressing this complex issue. Flourish St. Louis believes that our region needs to come together in new ways to make this a place where babies thrive and families flourish. Our vision is that every baby born in the St. Louis region celebrates a happy and healthy first birthday. We thank our initial funder, the Missouri Foundation for Health, for funding and supporting this initiative to make this new approach possible. With this backing, we have a strong start, but we now need others to join us in this effort to help us move change forward. Generate Health serves as a backbone for Flourish St. Louis with the role to organize and coordinate the initiative. The need for a new approach is clear when you look at how our community is organized. In St. Louis, we have individual organizations doing great work to support families in having healthy pregnancies and birth, but they often have to work in isolation. Even our service systems, such as food assistance system or childcare system, work in silos. But as illustrated here on the right, a complex problem like infant mortality doesn't operate in a silo. Everything is interconnected and dependent on each other to move forward. We can't expect to address a problem this complex with how we're currently structured in St. Louis. Flourish St. Louis is bringing together different sectors throughout our community to align efforts across the region, because no one person or organization can change a complex issue in our community by themselves. We call this taking a collective impact approach to solving complex challenges, and it's had great success in communities throughout the nation. Several other communities are having great success with addressing infant mortality through collective impact. In Harlem, where the infant mortality in 1990 was the worst in the nation, nearly 28 deaths per 1,000 live births, a concerted effort from organizations throughout the community dropped the death rate by 82% within 15 years. It's now down to 5 deaths per 1,000. Baltimore reduced its infant death rate by 28% in 3 years through a collective impact approach and reduced the disparity between white and black infant deaths by almost 40% during the same time period. If we had the same reduction in St. Louis, we would save 75 babies each year. Cincinnati cut the number of infant deaths attributed to unsafe sleep practices in half within the first year of its collective impact initiative called Cradle Cincinnati. We too can be this successful at reducing infant deaths in our region. And here's how Flourish St. Louis is starting to address the issue. We've brought together a cabinet of education, faith, business, and healthcare leaders, as well as impacted moms and dads, to find out why so many babies are dying in St. Louis. Together, we've made progress by creating a foundation of collaborative leadership that'll last for years. We're reviewing data about St. Louis's infant mortality crisis, conducted listening sessions with 350 family members to understand the stories behind the data, and raising awareness about the issue so more in our community can help take action on infant mortality reduction. Based on what we've learned, the Cabinet selected priorities and formed 5 action teams to bring the right resources together to accelerate change through aligning programs that already exist, supporting policies that lead to positive change, and aligning funding around the priorities. There are a lot of ways you can get involved and help Flourish. Go to our website to sign up for updates and to learn how to join an action team. You can also follow us on social media. Invite others you know to learn more about Flourish and share your ideas on what we can do to help families in St. Louis. And organize a group to write letters of love, our campaign to write letters of encouragement to new and pregnant moms who are facing some of the barriers we discussed earlier. You can find out more about it on our website. Thank you.